Baptist Health Foundation is the philanthropic entity that supports the 5 hospitals in the Brookwood Baptist Health System. So we get to be a part of so many amazing projects that are aimed at supporting and helping patients and families. We support pastoral care, and we support opportunities in the community.
The Baptist Health Foundation is really an incredible partner for us. And with them, they allow us to truly fulfill our mission of extending the healing ministry of Christ to our patients. The foundation has done a great job providing us access to special technology and equipment, which allows our staff to practice and to get more training and education. They've also funded really special projects to us, like the construction of our new chapel, which has become just a great retreat in a very busy environment.
It's a new chapel that we've recently dedicated. Most of the people who come to the hospital are in a very difficult and dark place, and we're able to bring the light of Christ into their situation because of what the foundation offers to us. It's a beautiful space, inviting and comforting to our patients, families, and staff. We could not accomplish and do the work and ministry of Christ that we do without the Baptist Foundation.
Several years ago, the foundation invested in these NICVIEW cameras, and we knew that they were important, and we knew that families would appreciate them and welcome them pre-COVID. But during COVID, they became a lifeline for these families to be able to see their babies.
Margot was born August of 2021. Pregnancy and birth were pretty normal, and then right after she was born, she was having some breathing issues.
She couldn't breathe, so she was taken to the NICU.
And we were there for 12 days.
We weren't expecting to not have our baby with us.
We've never been in the NICU. We've heard of friends, having that experience. So until you're actually in it too, you don't really fully understand what you're going to go through.
When the Willings were patients here in the NICU, COVID was taking place. There was a lot of restrictions on visitations, a lot of things where siblings couldn't come or family members couldn't come. So the NICVIEW cameras were very beneficial for their family members. And I think they really appreciated the opportunity to be able to use that.
Aunts, uncles, grandparents, they tuned in.
Say, hi, Daddy. Is that Margot? There's Mama.
Sometimes we were in the room, and so they would call us and be like, hey, we're watching. They were just as worried as we were about Margot's health and well-being. And so for them to be able to see her and see that she's okay, I think was tremendous to them as well. Today, she's doing great. She's an average 19-month-old. Nobody wants to leave their newborn baby at the hospital and not be able to see them, let alone hold them. Without the cameras, I think it would have been so much harder. I don't think I could have left her there. We probably would have had to take shifts coming back and forth to the hospital. Being able to watch her while we're at home was everything.
We had the opportunity to provide the cameras years ago, but now we know they're vital and they need to be replaced and they need to be upgraded, and we need the next family who comes into the NICVIEW to have the same opportunity that the ones before them have had.
Families, they're just blessed by it. They love to be able to see their babies. The technology has definitely changed, and so it's time for an upgrade, and we're excited about that.
The cameras are going to be a little bit more advanced, a little more user-friendly, and I think the families will really appreciate that when that takes place.
When you give to Baptist Health Foundation, you join this greater community who are working hard to be those hands and feet of Christ in our community. You join us in providing resources and services and being the hope that people need in a moment of darkness.